We're continuing our conversation from the television show today on the Blaze TV with Harvard epidemiologist and an expert advisor for the World Health Organization about the coronavirus. So we know that it's more contagious than the average flu. It's more contagious than SARS was. But we have heard and been prepared by the medical community for a long time that we're looking for, at some point, we're going to get a pandemic, and it could be as bad as the 1918 Spanish flu, and it would be devastating. And in that case, a third of the world was infected, and I think 10% of that infected died. I'm trying to just square we're expecting a pandemic. This one kind of looks like it could be. It may not be, but it could be. And I guess what I'm asking you is, what should we be doing now? Are we preparing enough in America? What should we be looking for?
Yeah, so this epidemic is very unusual. It's also different from SARS that it has about the same R0 as SARS in terms of 2.5 to 3.
Which means, hang on just a second, if you don't understand, that means, correct me if I'm wrong, one person has it, they will infect 2.5 to 3 people, right? And right. This has a 3, did you say 3.8? 1 to...
Well, it's between 2.5 to 3.
Okay.
That's the current estimate.
All right.
But at the same time, it's a little bit more infectious potentially than SARS, because SARS, you could only infect someone once you have symptoms. And there's lots of reports out. The BBC has confirmed it. Former FDA Commissioner Scott Gottlieb, as well as the Chinese Minister of Health, confirmed it, that you can transmit this even when you have no symptoms.
And that's up to 5 days.
That is really tricky.
Right?
Yeah.
Because how many
people...
incubation
time, we're not sure yet. But it is potentially infective even during the time it's growing in your body and you have no fever, no cough, no symptoms whatsoever.
And so is that...
And that is a little bit worrisome.
Is that what makes this so bad? Because other things you could say, I have a cough, I have the sniffles, I have, a fever. Don't go and mix with anybody until you know. This one,
right.
You might have met somebody who had it, didn't know it. They've been meeting a bunch of people. Now you've been meeting a bunch of people. And so it's harder to contain?
Right. It's hard to contain, and it's the middle of cold and flu season. Everyone's coughing and sneezing and have a small sniffle here. So this is why it's hard to disentangle. It becomes a little tricky. And so we don't know how bad it will be yet. Honestly, we don't know how bad.
When will we know?
I'm going to look for what the WHO presents tomorrow, because I think they're going to have a good estimate on the fatality rate, case fatality, for every infected person. What's their chance of dying? We think it's definitely under 10. There was a Lancet paper that said among hospitalized patients it was 11%, but I think overall population will be probably like 4% or less, which is less than SARS, but if it infects more people, it could affect as many or more. So I think we should just be very vigilant, and they are testing potentially, the vaccines they say they're going to get a vaccine in the field in 16 weeks. And certain HIV medicines, because this is a RNA virus, which mutates very quickly, they're going to see if some of the old HIV medicines potentially can work. They're going to test it. We don't know yet. It will be at least 6 months before we have treatment or a vaccine.
How often does something like this, something that it just is brand new, we don't have anything like it, how often do we come across a virus or something like this that takes us by surprise, that's new?
I think there's one that floats around every few years. We had a swine flu a few years ago. People were also very worried about Zika, as you know.
Right, okay.
There was, at one point they said, you should stop having kids for a whole year to some women in South America, and that was very scary. And Ebola, but Ebola was relatively contained. But I think these kind of things, the more people encroach into, wildlife, the more these kind of cross-species jumps will happen. This came from bats, supposedly, but the more population rises, density, these things will happen, and unfortunately, it's happening at a more frequent rate.
Okay, so is it true that the bat soup is a possibility? That's what
I don't know about that.
Okay.
It was an open seafood market. There are some studies that show half the people who got infected actually didn't even go to the seafood market. There's a science article on this, so I'm trying to quote something reputable. So we don't know if it truly is from the seafood market or before. We know they emerged somewhere between late October and early November. The DNA, the RNA analysis, the genomic analysis says it jumped from animals to humans then. But where it specifically started, we don't know.
And the record keeping in 1918 was almost impossible. We have no idea how many people really died from that. China is a sophisticated country with all kinds of monitoring now, but is the WHO going back and looking at those deaths that came maybe in early January or in December that were just flu-related or unknown cause of death?
In terms of what's happening in China, we really don't know. China tried to keep it quiet for the longest time, and then all of a sudden they've been releasing an onslaught of incidence results. I don't know if they've been queuing it up. I don't know how far back they can track it. We really don't know. Maybe they have this sophisticated technology to track where these people who were first infected were going in the city. But I think there is a lot of underreporting. There's lots of experts who agree there's a lot of underreporting of cases, people being turned away from hospitals because the hospitals are full.
Right.
Just go home. So I'm really looking forward to what the WHO will show tomorrow at their emergency meeting.
Will they be able to? We've never played that nurse on the air, the one that says she's from Wuhan. We have no idea if she is or not. But she said, listen, this is what's really happening. There are 90,000 people, that are quarantined or that are infected now. Is there any organization that can get into China, or has China changed their ways enough because of SARS that they're afraid of some backlash that has made them more open? Do we have any idea how trustworthy any of this information is?
Yeah, I really don't know. I was born in China. I speak a little bit Chinese, but I really don't know how authentic a lot of these videos are. I see them all the time. I am a person who absolutely does not like conspiracy theories.
Yeah.
So I think what we do know is there's definitely underreporting. China was delayed in reporting for a lot of these cases, and hopefully they start getting real and putting out the numbers out there because the world demands it. So I think the best numbers come from like Imperial College. They estimate the 2.3. Their research center is a WHO center.
Okay.
I'm assuming they get more inside data than other people who are publishing wild estimates just from published internet numbers.
The thing that has made me feel comfortable, I live in Dallas, and I think we had the first, didn't we have the first Ebola case in America was here in Dallas. And man, our hospitals ran really, really well, and they were on top of it. Is there anything that our hospitals should be doing? Is there anything the president or Congress or anybody should be doing right now to prepare? Is there something we're missing?
I think, first of all, CDC funding. We must restore CDC funding. CDC funding was cut a lot in recent years. We have to boost CDC emergency planning funding and other research funding enormously. NIH funding, NIH vaccine discovery and research, all the infrastructure that if a pandemic or epidemic arrives, we need to mobilize as many resources as possible to find a treatment, find a vaccine, contain them as fast as possible. And for that, you need a good public health agency like the CDC and NIH research that was fully ready and staffed to address any calamity or pandemic.
Okay, so they say there are no stupid questions, but this is probably one of them. I've always thought that you feed a fever, starve a cold. there's nothing you can do with a virus. There's you go and you have the flu, it runs its course. How are we developing a vaccine? First of all, is that true? And how are we developing a vaccine for something that's a virus?
So vaccines are for viruses, but you have to synthesize a virus that recognizes the vaccine. And you hope that the virus doesn't mutate fast enough. Like measles vaccine, it doesn't mutate that quickly.
Right.
And if you have one measles shot, you're good for like a decade. But flu vaccine, you need a brand new one.
Okay, but
secondly,
that won't be I mean, if you have it already, that's not going to help
it won't.
you.
But there is a class of drugs, because it's an RNA virus. An RNA virus, like this coronavirus, they mutate very quickly. RNA is like a dirty, sloppy version of a DNA. And because it mutates so quickly, it has potential to escape a good vaccine. Even if you find one, it'll change by next season. But at the same time, HIV is also an RNA virus. And a lot of drugs like protease inhibitors that work to slow down HIV could also slow this down. So they tested certain protease inhibitors in the past, and it has a small efficacy on SARS. So we're hopeful that maybe this coronavirus might also be slowed down a little bit by some of the protease inhibitor drugs that use in HIV. That said, this virus and SARS is like 79%. That's like it's 79% genetically identical. That's like us and elephants. So there's no guarantee that these HIV drugs might work, but it's possible, and we have to test it. We won't know for sure until we do the trials.
Last question, because I'm really concerned not just of the deaths even if it passes and it's only mild, it'll still kill a lot of people. So I'm concerned about that, but I'm also concerned at the economic ramifications. China shutting down their steel industry will impact the world in great ways. The airlines not allowing people to travel, et cetera, et cetera. When will we know this has run its course? How do you know when this is passed?
I think whenever the epidemic curve starts going down. Right now, if you look at the map, in China, the incidence curve is hitting the sharpest part of the rise. And other parts of the world, it's also at a very sharp rise. Until it plateaus and then hopefully goes down, then it might be going away. It's not expected to plateau until at least February or March, depending on how well we contain it. So, the R0 can change. The effective R, the effective R, if you have perfect quarantine, you have a good vaccine, you can bring it less than 1. And bringing an R0 less than 1 means each person infects less than 1, and that means over time it will go away. So let's hope we find really good containment measures and hopefully a good treatment, and seasonally maybe it blows over for the next 2 months.
Great. Thank you very much, Doctor. I appreciate it. By the way, if you want to see more, you want to see the beginning of this interview, and also our coverage on the news and our insane coverage of what's happening in Washington, make sure you subscribe to The Blaze. We need you to help keep us going. We depend on you. So please join us. You have Mark Levin, you have me, you have Steven Crowder, and you've got dozens of other really big names. This is the cutting edge of conservative and constitutional thought, when you can have me and Steven Crowder, Mark Levin, and Dave Rubin all in the same room, and we're all getting along, not yelling at each other, even though we might disagree on things. That's the way we need to be. Join us at blazetv.com. Use the promo code Glenn, and you will save 10% now. Promo code Glenn, blazetv.com.